Excel is a very unique experience. We are here to meet your needs by making sure we provide you exceptional pain management with our nurses, aggressive and thorough rehabilitation, and education to assist you in returning home one day after your surgery. This is a really nice visual of how our program works. You receive coordination of care from day one to full recovery. That means you have a nurse assigned to you who will help guide you through the process and educate you before, during, and after surgery. You also have surgery in an ambulatory or outpatient surgery center, which has its own unique set of positive experience and outcomes. You get to recover in one of our comfortable and private orthopedic recovery suites, which we will have an image of later in the presentation. We also have a very simplified billing process, which hopefully helps ease any type of worry or concern you have regarding this procedure. We have a network of individuals who work behind the scenes to help make sure that you have a wonderful and seamless experience. Our nurse coordinator team includes Courtney, Donica, Sandy, Emily, Kate, Wendy, Stephanie, and Jessica. Our program director is Leah Zimmerman, our therapy manager, Nicole Meyer, and all of our wonderful nurse and therapy educators who teach this class on different platforms. Excel coach is very important. You can have one person or a network of individuals who help support and encourage you throughout your pre-surgical preparation and your recovery following your procedure. We don't need the coach there at all times, but there are some key points where we want your coach to be involved. The coach needs to drive you to the surgery center and stay there throughout the procedure. Following the procedure, the surgeon will call or meet with that individual to update them on how the procedure went and answer any questions or concerns that you may have. We would love to have someone available in the care suites the day after surgery in the morning for the final physical therapy session and discharge education with the nurse before you go home. We also need someone to drive you home because even though many of you are very independent, you obviously cannot drive home immediately following your procedure. Plan for someone to stay with you for at least the first couple of days after you return home, or at least have someone that's available should you need something. You won't be able to drive immediately after surgery, as I noted before. There is at least no driving until your first follow-up with your appointment with your surgeon team. Typically, most surgeons have your first follow-up appointment at week 2 or 3 post-op. The surgeon will then provide you the timeline for driving clearance. Just to get a general idea, most people who have surgery on their lower extremities, if you had surgery on your left side and you are not taking narcotic medications, then typically the surgeon will let you drive if you're comfortable. If you had surgery on the right leg and are not taking narcotic medications, it will depend on the surgeon and also your stage in recovery. Sometimes they will make you wait until 3 or 4 weeks. If you are having an ankle replacement and or a shoulder replacement, those timelines look a little bit different depending on which side you had done and the comfort level as well as the healing process. The surgeon will let you know for sure what that looks like more realistically at your appointment. Think about all the things that you need help with after your surgery. Things like running errands, getting groceries, going to the pharmacy for medications or other needs, transportation to doctor's appointments or physical therapy appointments, and household activities like cooking, laundry, yard work. Look around your home and think about some different things that you would need to have ready to go before surgery. Ultimately, we don't want anyone to fall after surgery, so these are just a few tips and tricks that we have put together to get people ready for surgery. Arrange your furniture to allow clear pathways. Well, that may seem kind of strange as you know your own home. You will be walking with either a walker or a cane or sometimes crutches. You may have a knee scooter or you may also have an immobilizer on your shoulder. So you may need more room to navigate. And if you have something going on in your home where maybe you have boxes stacked, moving, remodeling, those types of things, you just want to keep in mind that you're going to need a little bit more room to navigate safely through your home. Make sure you have good lighting in the hallways for when you're getting up in the middle of the night. And then any loose rugs that you may have in your home should either be removed or secured so that they're not a tripping hazard. Make sure you store dishes, cookware, or bathroom products that you use often in an easy to reach location or at counter height so that you're not bending over a lot or reaching up or struggling to get those things that you use every day. Also, think about some other things that you may need depending on how your home and bathroom is set up. Any of these items that I'm going to talk about can be found at a durable medical equipment store. Sometimes those are in small town or local area towns, still, like a brick and mortar type store. Otherwise, Amazon or Walmart.com all have these options at very reasonable prices. So a shower chair or a bench, a raised toilet seat, uh, a stocking donor, long-handled reacher, long-handled sponge, or long-handled shoehorn. You can type in hip kit in Amazon or also in Walmart, and that will generate kind of a bundle of items that include little things to help with socks and reaching things off the floor, all of those things I just named off. So that's a hip kit, and anybody can use that. It's not just for total hip patients, and we can show you how to use those things in our care suites as well. And then for our ankle patients, a rolling scooter can be obtained from the surgeon team. So be sure to ask about that if that's something you're interested in to help with your mobility. And we always recommend that our shoulder patients find shirts, tops, things, and jackets and things that button or zip easily. There's also a lot of options on the internet for post-operative clothing, shoulder surgery clothing, things like that. You should be able to find many options. You also receive one walking device with our program. So a walker, crutches, or cane is provided as part of our program, and we'll advise you on what is most appropriate for you when we see you in our care suites. Everyone should have received a book that is specific to the procedure that you're going to have with our program, and it has exercises that we really encourage you to do prior to surgery. Studies have shown that exercising the muscles around the joint before the procedure can really significantly support your recovery process. Exercises support our joints and help off-weight stress on our joints. And we always recommend that you try these exercises that are in the book. You don't have to do them every single day, or even perhaps every other day would be good. Try the exercises. If there are any exercises that cause more joint pain versus muscle soreness, which is okay and is normal, then perhaps only do the exercises that you feel you can tolerate. Also, it's important to note that if you already have a regular exercise program that you can tolerate despite the pain that you're having in your joint, be sure to continue that up until surgery as best you can. You won't be able to resume that activity quite as quickly following surgery, but it will significantly affect your recovery process. It's very important to keep moving as much as you can.
Okay, and then preoperative history and physical. So I know all of us are on slightly different timelines on the call, but if you have not yet scheduled your pre-op appointment with your primary care provider, please do that as soon as possible. Ideally, we like to have that appointment set up 21 to 29 days before your surgery date. And the reason for that is that sometimes at that appointment, they determine that they might want you to come in for a blood pressure recheck, or sometimes they want a lab value redrawn, for example, and this gives us plenty of time to get that done without having to delay your surgery. So our team will ensure that all information from that appointment has been received. And while you're at that appointment, you want to ask your primary care provider about all of your home medication. So go through that list really carefully one by one with them and get very clear on when and if they want you to stop taking certain medications leading up to surgery, or if there's certain medications they want you to take even morning of surgery. Lastly, please alert your surgeon or Excel team before surgery if any of the following take place. So if you become ill, if you are hospitalized, if you are prescribed or taking antibiotics, or if you have any open areas or cuts on the surgical extremity. And then in terms of packing for your stay, so I personally am an overpacker, and I like to give everyone a heads up who may also overpack sometimes that you're actually going to get sent home with 2 additional sets of Twin Cities Orthopedics athletic wear. And many of our patients honestly don't even change into the clothes they brought from home because they're so excited to have these new outfits. So that being said, if there's a certain, sweatshirt or loose comfy clothing that you're going to want from home, by all means, bring that with you. But otherwise, you really don't need a ton of clothing. Um, Shoulder patients, please bring a zip up or button up shirt. Those are much easier to navigate with your sling versus those that you pull overhead. So we like to have some of those with you so that your physical therapist can kind of practice navigating your sling using those shirts. Supportive shoes are important. Toiletries, cell phone and charger. If you typically use a CPAP or a glucometer, please bring those with you. And then something that's really important to note is that home medications need to come in their original prescription bottle. So these would be any medications that you were taking leading up to surgery that are unrelated to surgery. So, for example, blood pressure meds, cholesterol meds, thyroid medication, things like that. Underneath our specific licensure, we cannot give you medications that are in a Ziploc bag or in a pill organizer. So if there are medications that you know that you're going to want to take while you're with us, we do require them to be in their original packaging, whether that's from the pharmacy or in an over-the-counter bottle. And then on the note of prescription meds from your surgeon, we do ask that you please leave all of your post-operative prescriptions at home, just because we have all of those same medications here at the Care Suites waiting for you, and we wouldn't dip into your home stash, and we also don't want folks traveling with controlled substances. So please leave those medications at home, and we'll have everything you need while you are with us. We do have a little medicine cabinet in your room here, so any medications that you bring, your nurse will be going over those with you and then locking them up in a cabinet in your room, and those will be returned to you prior to discharge. If you are someone who experiences stomach upset with food, please bring your antacid with you so that we have access to that if you need it. And then for our ankle replacement folks, if you plan on using a rolling scooter, you might want to bring yours with you just so you can practice that on your walks and working with therapy. And then please leave all jewelry and valuables at home as well. So prior to surgery, you will receive either a phone call or a text message verifying what time you need to arrive to the surgery center, as well as advising you on when you need to stop eating and drinking. This communication will take place 24 to 72 hours before surgery and can even come on the weekend. So don't worry if you haven't heard from us. I promise you will. It might be closer to that 24-hour mark. And then in terms of when to stop eating and drinking, you can have a normal meal up until 8 hours before the procedure. You just want to try to avoid any heavy, fatty, greasy, or spicy foods, and then no using tobacco products within 8 hours of surgery as well. At that 8-hour mark, you will switch to clear liquids only. So you can have things like water, tea, Gatorade, black coffee. We just don't want to add anything additional to any of our beverages so we can be sure that those stay clear. And then at the 2-hour mark, that is when you would have nothing else to drink. On the right-hand side here, you'll see the only exception to that is if your doctor tells you to take certain medications the morning of surgery, it is okay to take them with a small sip of water, even if it's after that 2-hour mark, but please only take a teeny sip just to get the pills down. We really don't want you to drink any more than that. And then everyone will take 2 pre-surgical showers. So these showers are really just for us to try to decrease any bacteria that's on our skin to get you nice and ready for surgery and decrease that infection risk. There is a special type of soap that you will need to purchase called HibaCleanse soap, and you can get this from any drugstore or pharmacy. So you'll take 1 shower the night before surgery and 1 the morning of. And what you're going to do is you'll first use your own shampoo and conditioner the way that you normally would. And then you're going to wash everything from the neck down with the special soap, the HibaCleanse soap. You'll wash the surgical site for 2 to 3 additional minutes. You will rinse off, use a clean towel to dry off. And then you're going to sleep on clean bed sheets and in clean pajamas. In the morning, you will repeat all of these steps, except you're going to use another clean towel and you'll put on clean clothes before heading to the surgery center. They do ask that you please do not apply any product of any kind after surgeries, or sorry, after each shower. So no lotion, no deodorant, hair products, things like that. You can resume use after surgery, but just after these showers, we're working really hard to get bacteria off of our skin. So we just are trying to be careful with not putting any new bacteria on our skin. If you are someone who shaves your surgical extremity, please do not shave within 7 days of surgery. Anytime we shave, there's little microcuts in our skin that can pose an infection risk, and if you accidentally cut yourself, there's always a chance they'll have to delay your surgery. So it's just not worth taking that risk. However, facial shaving is okay. So day of surgery checking in, you will bring your photo ID, your insurance card. If you have an advance directive and want to bring that with you, you absolutely can. You'll also have the opportunity to join what's called the Total Joint Registry. This is an elective registry that tracks patient outcomes based on the type of implant that your surgeon used. It's kind of a cool opportunity to be part of a long-term study on the different implants that our surgeons use. It's totally voluntary. You do not have to join, but if you do choose to join, I just like to give folks a heads up that they will be asking for your social security number. Next, you'll get an armband placed that has your name, date of birth, and any allergies, and then we ask that you please remove all jewelry prior to arrival. And then here in pre-op, your coach will still be with you. This is where you will change into a hospital gown. You'll meet with the surgeon and the anesthesiologist. You will sign consent forms, go over any questions you have about the procedure. They will mark the surgical site, and then you will get an IV started by a nurse. And then day of surgery in the operating room. So your surgical team will consist of your surgeon, their first assistant, anesthesia, a surgical tech, and a nurse. We always do what's called a timeout safety check, both before a nerve block and upon arrival to the operating room. That's just an opportunity for everyone on your team to gather and be sure that they are ready to begin the procedure. Next, anesthesia will be administered, and then you will be continuously monitored and observed in the operating room. And then here we're just going to cover the different types of anesthesia that we use. This is a very broad overview. If you have specific questions about the type of anesthesia that they'll be using the day of surgery, you can connect with your surgeon team about this. But I'm just going to go over a broad overview here. So the first type is spinal anesthesia. With spinal anesthesia, this is what most of our surgeons do request to use. And with that, you are given a numbing medication, and then a thin needle gets placed into your lower back vertebrae, resulting in temporary numbness and weakness from your rib cage all the way to your toes. You are then given IV sedation and will remain in a sleep-like state throughout the entirety of surgery. Once surgery is complete, they will back off of those meds, and your team will be there monitoring you. The next type is general anesthesia. This is when drugs are injected into your bloodstream, or sometimes they're breathed into the lungs, and this results in total unconsciousness, so your brain becomes unresponsive to pain signals and reflexes. There's always a chance that you will need a breathing tube just during surgery when you receive general anesthesia, and when surgery is complete, they will decrease those medications, and then you will wake up, and again, your team will be there with you. And then sometimes in addition to anesthesia, you'll also receive a nerve block. A nerve block would never replace anesthesia. It's always given in addition to. And with that, you are given drugs that are injected near your nerves, and this provides a loss of sensation to a specific part of the body. So you'll have that temporary loss of feeling and or movement to a specific limb or area. So the type of anesthesia that you receive will be based on your surgeon's preferences, your medical history, and then collaboration between your surgeon and the anesthesia team.
All right, let's talk a little bit about how a total knee replacement works. So we'll go over each procedure. Uh, the surgeon begins by making an incision on the front of the knee, and they open up the joint so that they can assess the damage. They remove the damaged cartilage and reshape the bones to provide a stable platform for the implant. Bone cement may also be applied to secure that implant. The implant is a piece on the femur, which is our thigh bone, and the tibia, which is our shin bone. And they're made of some type of metal or titanium. But I do encourage anyone to ask the surgeon if they have specific questions about the implant type that the surgeons use. A plastic spacer is then placed between the two bones, so between the femur and the tibia, which allows the joint to glide smoothly and naturally as it did before there was any pathology present. They then take a look at the kneecap or the patella, and they rotate that over. They don't remove it. They rotate it to the side essentially and assess it for any type of damage. Most of the time there is damage on that underside of your kneecap that you can't feel that goes against your bones, and they'll reshape that, resurface it, and then place what's best described as a plastic button over the area that they resurfaced that fits with the grooves of the implants on the femur and the tibia, kind of like a train glides on the tracks where it fits in there like a puzzle. When all of those components are in place, the surgeon tests them out to make sure that the knee flexes and extends with a normal natural motion, and then the incision is closed with either suture staples or medical grade glue. The surgeon time for those that are waiting is typically between 1 to 2 hours. Let's talk about the total hip replacement next. So the hip is a different type of joint than the knee. It's a true ball and socket joint. And they make an incision depending on the surgeon and their preference, either on the front of the hip, the side of the hip, or the back of the hip, going through different muscles. So the procedure is exactly the same. They just go through different muscles to get there. So they begin by removing damaged cartilage and bone from the hip socket uh, and smoothing that out. And then a metal socket is placed into that cavity initially. That is secured with bone cement or screws, depending on the anatomy of that individual's hip. And then a liner is pressed into the socket, which is a plastic piece that is the new smooth surface for your new joint space or joint surface. So it has a nice smooth surface to glide on. The end of the femur or the the ball is removed, and then it is hollowed out to make space for the implant. And the implant is called a stem, and they place that stem down into the shaft of our femur or our thigh bone. The top of that stem is then fitted with a ball, so that's your new ball that fits into your new socket. And the joint is tested to make sure that it's moving the way that they want it to. The incision is then closed again with sutures, staples, or a medical grade glue, and surgery time for a total hip replacement is between 1.5 to 2 hours for those that are waiting. Let's talk about the shoulder next. So the shoulder looks a lot like the hip. It's not quite a true ball and socket. It relies a little differently on our rotator cuff musculature, which supports our shoulder with every movement that we do. So they make an incision in the front of the shoulder, kind of just over where our armpit or our axilla is. And similar to the hip, they remove the head of the humerus, which is our arm bone. And then they reshape the glenoid, which is the space that's in our axilla or our armpit, to make a nice smooth surface for our humerus or our arm bone to glide on. They attach a plastic component to that glenoid so that surface is smooth. And then they also hollow out the inside of our arm bone or our humerus and make a nice space for the implant or a shaft for the implant to go into. Once that implant is placed, they put a new ball on the top or on the head of our humerus or our arm bone. And then again, they test that to make sure that it moves the way they want it to. Typically, our shoulders are closed with some type of sutures or medical grade glue. The time for shoulder surgeries is usually around an hour to an hour and a half. Let's talk about the ankle last but not least. So, in the beginning of the surgery, they'll make an incision on the front of our ankle or the front of our foot, essentially. And they begin by removing a portion of the tibia, which is that bone that we often call our shin bone. It's that larger bone in our lower leg. So they remove a portion of the tibia and the talus, which is the back part of our ankle. And the surgeon may also remove a portion of the fibula, which is that outside bone that we often call our ankle bone, where sometimes if we sprain our ankle, that's that little bone on the outside that we point to when we have pain there. They then insert the implant, which is a talar and tibial component, and a plastic cup is then positioned between those to allow our foot and ankle to move up and down into dorsi or plantar flexion, which is our normal movement up and down if we go up and down on our toes or bring our toes towards our head. Sometimes, depending on the need and what the ankle looks like when the surgeon goes in, they may choose to also fuse that fibula and tibia, those two main bones in our lower leg, with either a bone graft or sometimes they'll use a plate and screws, as you can see in that image number 4 on the bottom right of the screen. The surgeon then tests the new joint and closes it with sutures or staples, and the ankle is bandaged and placed in a splint or cast. The procedure is again typically somewhere between 1 to 2 hours.
Okay, so day of surgery in the recovery room. This is where you will come to after surgery. So your nurses will be closely monitoring you as you become more alert and awake. They'll be carefully managing any pain or nausea if you're experiencing either of those. And you're going to notice that sensation will gradually return to your surgical extremity. You'll also be given snacks and fluids and then assisted to the bathroom before heading to the care suites. So if you are having surgery in Chaska, Blaine, or Plymouth, you will be transported via wheelchair to your room because the care suites are actually in the same building as the surgery center. But if you're having surgery in Egan, Edina, at High Point, or in Maple Grove, you will be transported in one of our medical vans with a registered nurse and a driver. These vans are wheelchair accessible, so you will remain in a wheelchair the entire time. You won't have to walk to the van or walk to your room or anything like that. You will remain in the wheelchair with your nurse all the way until we get to your room. So this is an example of one of our care suites. Our suites are staffed 24/7 with Excel registered nurses. You will recover in a private room and bathroom. And our rooms include an adjustable hospital bed, a recliner chair, and a TV. Meals and snacks will be provided to the patient. We don't have them available for guests, but there's lots of local restaurants nearby, many of which will deliver or are just a short drive away. Smoking is not permitted in the suites or on the facility property.
Everyone receives physical therapy during your stay in our care suites. With our total knee and our total hip patients, you will receive therapy the day of surgery and the day following. Our total ankle and total shoulder patients receive therapy in the morning before you go home. Therapists will come in and talk to you about what therapy will entail and what your specific goals are. We'll also ask you some questions about what your home looks like, how your home is set up, any questions or concerns you might have about navigating through your home. We're going to review your postoperative precautions if you have those or any restrictions, just depending on the procedure that you had. We'll also review your therapy exercises. You will do those exercises with us to make sure you understand them, and we'll give you handouts as well so that you have that home program and contact information that you need should you have questions or concerns. Everybody gets to go for a walk. Our knee and hip patients, we do some functional outcome measures, and then everyone does the stairs the day after surgery. So that morning therapy session before you go home to make sure everyone is safe and confident on navigating the stairs following total joint replacement. We also make sure that you have the best assistive device that's needed for you depending on your procedure. So a walker, crutches, or cane is always provided as part of our program. And then our shoulder patients have their immobilizers or sling that they wear. And then our ankle patients are also provided typically a walker or crutches. And then if they opt to have that rolling scooter as well. So we will get you exactly what you need, and we have what all of these devices here in our care suites as well. So if you already have something at home, there's no need to bring that with you, and we'll answer any questions that you might have about the one that you have at home as well. We also are happy to answer any questions or concerns you have about how your home is set up. We are welcome to take photos if you want, if you have questions about different areas in your home. Sometimes people have narrow doorways or smaller bathrooms or things like that. So please bring any questions or concerns that you have. The key to success is truly early movement, and we move you early and often in our program to help you get used to that new joint and make sure you feel confident and comfortable before you go home.
So now we're going to talk through pain management. Our goal is for something called functional pain management, which essentially means keeping your pain at a tolerable level. So our focus is reducing your pain enough so that you can rest and so that you can successfully perform your physical therapy and exercises. So we use what's called a multimodal approach, meaning we use both medications and non-medications to treat pain. So examples of this are actual medications, ice and elevation, guided imagery, aromatherapy, relaxation, sleep, and walking. And we're going to talk about each of these in a little bit more detail. So the first one is actual pain medication. So your nurses are going to be working closely with you to determine a pain management plan that is unique to your needs and your pain tolerance levels. So we will be assessing your pain frequently. We'll be figuring out what you need to keep your pain in a good spot. And so medications that we may use include Tylenol, which would be scheduled every 6 hours if your surgeon prescribes it. Anti-inflammatory medications, which would also be prescribed every 6 hours if your surgeon prescribes it. And then we have some as-needed medication options. So examples of this would be muscle spasm medications, which are really nice for stiffness, tightness, muscle spasms. They also can make you a little bit drowsy, so they can be helpful for sleeping. And then also narcotic pain medications, which we'll talk to you carefully about how to know when to take narcotic pain meds. We really only want you to take these when your pain is consistently climbing and is close to crossing a threshold where it's no longer tolerable. If your pain is tolerable, then we would recommend that you would hold off on taking narcotics until your pain level continues to rise. And then icing is a huge part of controlling pain and swelling. So everyone will get sent home with ice packs. We recommend icing for 20 to 30 minutes at a time. We do recommend taking breaks in between icing sessions to give your skin a break, but icing throughout the day is really going to help so much. If you can ice and elevate at the same time to help get those toes above your nose, that's awesome. And then also for our shoulder patients, just elevating your arm on a pillow is really helpful as well. We do have some optional icing rental companies that we work closely with. If you're interested in renting an ice machine, just to make icing a little bit more convenient, let your nurse coordinator know and we can help coordinate that. But just know that any type of ice therapy will help control pain and swelling. And then guided imagery is one of the non-medications that I mentioned. So pain impacts both your physical and mental self. And guided imagery provides a focused relaxation that helps create harmony between the mind and body. So examples of this are even just listening to relaxing music, a white noise machine, meditation, whether that's a guided meditation or like a visualization or something like that. Evidence does show a reduction in post-operative opioid use for folks who utilize guided imagery. And you can find guided imagery on YouTube if you were to type in guided imagery for pain or sleep or guided meditation, white noise, anything like that. Tons of options would come up. There's also some free apps listed here that you can download that I know all of these have some free content, and there's way more apps than this available as well. If you were to just do a search on guided imagery, tons of options would come up on your smartphone. And then another idea is just spending some time making a playlist with music that you find relaxing that you can use throughout your recovery. Highly recommend doing that as well. Distraction is going to be a big tool during your recovery. So, doing things that you enjoy that can help take your mind off of some of the discomfort that you might be experiencing. Examples of this could be art, crosswords, word puzzles, movies, books, podcasts, whatever it may be for you. And then sleeping and napping, of course, allows your body time to rest and promotes healing. But I just like to normalize that it can be a little tricky to have your normal sleep schedule for a few weeks after surgery. If you are continuing to struggle with this and it's not improving, please reach out to your Excel nurse. So, with some of these complementary therapies, I just like to kind of explain how they work. So, pain gives your muscles or pain causes your muscles to tense and tighten. And when you're able to relax, you're also helping the muscles in your body to relax, which helps decrease pain. So, that's how some of the complementary therapies help to decrease our pain levels. We also have these little aromatherapy patches at all of our sites. We have different patches for different purposes. There's one for pain, one for sleep, nausea and vomiting, and urinary retention. If you are interested, please let your nurse know. We have these at all of our locations. Patients really like them, and we highly recommend them. So, in terms of pain management, we're just going to talk through how things are going to kind of evolve after you get home. So, during that first week, it is very normal to have an increase in pain and swelling. It does not mean that anything is wrong or that you are regressing. It's actually just part of your body's natural healing process. So, nothing to worry about or fear. We just like to normalize so you know in advance that you might notice kind of an uptick in that pain and swelling after a couple days at home. The good news is eventually that's going to continue to trend down, and we'll talk about that here in a moment. But during that first week, we want you to keep up with icing. So, again, 20 to 30 minutes at a time, at least 5 to 6 times a day. Just make sure you're taking breaks in between those icing sessions, and also make sure you always have a barrier on your skin so that you're not putting ice directly on your skin. Elevating your leg, or again, for our shoulder folks, elevating your arm on a pillow can be really helpful to reduce swelling. And then you want to get up for short, frequent walks during the day. We don't want to overdo it, but it is important to get up to just get your blood pumping, help lubricate that new joint, and it also helps prevent constipation, as well as blood clots, which we'll talk about a little bit later in the presentation. And then with that increase in pain and swelling, this might be the week where you're taking more frequent pain medications. It also might not be. Everybody's a little bit different and has different pain tolerance levels, but just like to give you a heads up that you might need some extra support during this first week to manage some of that pain. The good news is that during weeks 2 to 3, you're going to notice an increase in your activity tolerance. So just make sure you continue to pace yourself, allow for rest breaks, listen to your body. If you experience more pain and swelling, that's an indicator that you did too much. So kind of scale back if you notice that, but keep up with icing, elevating, and then those short, frequent walks. And then you're going to notice that you don't really need that pain medication as much. So either you will reduce the amount that you are taking, or you will increase the time between doses. And then proper nutrition is really important during your recovery. It helps promote wound closure, it reduces infection risk, and does prevent delayed healing. So, staying hydrated is huge. So, having a water bottle that you are maybe setting a little water goal for yourself, refilling that throughout the day, making sure you're getting plenty of water. And then In your blue education book, there's more information on different food groups related to healing, but the biggest ones to focus on are protein and fiber. So just make sure that you're getting plenty of that. It's also totally normal for your appetite to be a little bit different after surgery. Some people find it more comfortable to eat 5 to 6 smaller meals a day versus the 3 larger meals. And just make sure when you are eating meals or snacks that they are high in protein. So examples of that would be lean meats or eggs. And then anytime you have surgery, you are at an increased risk for constipation. There are several factors that contribute to this, including some of the medications you might be on. For example, narcotics, or some of you might be on iron supplements, depending on what your hemoglobin level is after surgery. Dehydration, not getting enough exercise or movement in the day, and then decreased fiber intake. So to prevent this, you want to stay hydrated, keep that water bottle next to you, refill it throughout the day. Walking is a natural stimulant to get that GI tract moving. We want you to do those short, frequent walks throughout the day. We are going to send you home with 2 stool softener medications called Senecot and Miralax, so you do not need to go out and purchase stool softeners in advance. We are going to send you home with these, and we're going to go over in detail how you take these, how you know when to stop taking these, all of that good information. But if you know something that has worked really well for you in the past, perhaps it's a certain medication, food, or juice, it's not a bad idea to have that on hand just in case this becomes a post-op issue. Lastly, please do not wait to reach out if you're struggling with this. Please let your nurse coordinator know as soon as possible so we can try to get ahead of it. And then everyone will discharge to home 1 day after surgery. So this is after your morning physical therapy appointment. Your surgeon will round on you during your stay, either in person or some of our surgeons round virtually. And then something that is important to note now is that discharge is typically somewhere between 9 and 11 a.m. So please let your coaches know now that the earliest they may need to arrive the day after surgery could be 8 o'clock a.m. Just because we really like to have them here for your final physical therapy session and for discharge education. We go over a ton of information at these 2 different sessions, and so it's really helpful if you have your support person with you so that you're not trying to take in all of this information by yourself. We will confirm that time as soon as you arrive to the care suites after surgery, but we like to give your coaches a heads up in advance so they can schedule their day accordingly and be available as early as 8 a.m. if needed. When we go over discharge education, we review medications, pain management, signs and symptoms of complications, as well as how to care for your dressing, how to shower, and we will also remind you of any appointments you have scheduled, whether that is with your surgeon team or with physical therapy, if that is applicable to your surgery.
Let's talk a little bit about complications. So these are things that are always a risk with any type of procedure, but things that we don't see very often. So a deep vein thrombosis or a DVT is a blood clot that forms in a vein in the body. And it can present in operative or non-operative leg, and also for people who have had shoulder surgery as well. We are all at risk because after surgery, our body is working to protect itself. Our body does a lot of amazing things, and it's in what's called a hypercoagulated state, which means it's trying to protect your body from bleeding. So any type of stagnant blood flow from sedentary activity or just prolonged periods of rest is going to cause more of that hypercoagulated state. A DVT presents itself similar to symptoms that we have after surgery. So, swelling of the leg, pain or tenderness, increased warmth, and red or discolored skin. This will be significantly pronounced, and oftentimes individuals will complain of a sharp, searing type pain or discomfort in the calf, along with significant redness and swelling in the calf that is much more pronounced than previous and doesn't go away with any type of exercise or movement. Please be sure that you call your Excel coordinator or surgeon team if you have any questions or concerns. I always like to say that we do this every day and you do not. So there are no silly questions. We want you to reach out. Again, very rare that we see these types of things, but important that you reach out to us if you have questions or concerns. We prevent blood clots by doing a few different things in our program. The provider does prescribe medications to thin your blood. So typically that's aspirin or some other type of medication, depending on the surgeon team and sometimes your medical history. Walking and ankle exercises. So we tell you to get up often during your day, during waking hours, to take short, frequent walks. Also, doing ankle pumps, no matter what your procedure was. And obviously, with our ankle patients, ankle pumps on that non operative ankle. Make sure you also communicate with the surgeon if you've planned a long air travel or a long car ride, especially air travel within the first 6 to 8 weeks after surgery. Please let your surgeon team know. Sometimes when you are going to be traveling in the air, they do want to take additional precautions. And typically, we tell people who are taking longer car rides that they should make more frequent stops or be able to do those exercises somehow while they are in the vehicle. A surgical site infection is something that we'll see sometimes a few weeks after surgery. Again, very rare to happen, but signs and symptoms of an infection would include drainage or cloudy fluid from the site, so ongoing drainage. Initially, you're going to have drainage that is pink or red, but this would be ongoing drainage a few weeks after surgery that may also have a different color or sometimes an odor, pain or tenderness, localized swelling and redness around the incision specifically, sometimes extending into the extremity, the arm or the leg, and increased heat from the surgical area, as well as a fever. The fever would be somewhere around 101, 102. That's persistent, and you're also not feeling well. Oftentimes, people do have low grade fever that would be more immediately following surgery as the body's adjusting to the implant. So please remember to reach out to your Excel coordinator or surgeon team if you have any concerns regarding this. It's also important to note that Twin Cities Orthopedics does have orthopedic urgent care locations located throughout the metro. You can find these easily on our website, and they are open most days except for specific holidays from 8 a.m. to 8 p.m. So you can go in and see one of our orthopedic providers who can also connect with your surgeon team at any of those times. So we do encourage that as well if you're not able to get into the clinic. We discourage our patients who are having any concerns of a more urgent nature regarding their surgery to go to the emergency room simply because you'll probably be waiting a very long time, and we have our orthopedic urgent cares with short wait times and specific orthopedic providers to take good care of you. How do we prevent surgical site infection? Number one, good hand hygiene. Washing your hands, as we all know, is very important. Again, no shaving that surgical site within 7 days prior to surgery, making sure that you follow showering instructions. So, taking that pre op shower the night before surgery, the morning of surgery, making sure that you use clean towel, clean washcloth. Clean sheets and clean clothing, pajamas, and the clothes that you wear to the surgery center. And then the nurse will also give you specific instructions regarding your dressing that you have over your incision as well. Some are waterproof and others do need to be changed, so the nurse will talk to you about that. Make sure that all of your dental work is up to date prior to surgery. Anytime that you have a total joint replacement, you are not allowed to have dental work for 3 months following that procedure. Following surgery, the surgeon team will prescribe antibiotics that you will need to take prior to any dental work to prevent infections. This includes cleaning. Typically, it's one dose of an antibiotic approximately 1 hour before your dental appointment. This prescription is sent to your pharmacy at one of your postoperative appointments with your surgeon team. So you just need to call prior to that dental appointment to get that prescription filled. The surgeon will review this at your follow-up and guide you on the timeline that they have for taking antibiotics prior to dental work. Let's talk a little bit about postoperative physical therapy for the hip. So, you may or may not have precautions for a short time after surgery. These are sometimes in place depending on the surgeon and their preference, just to make sure that the hip is well healed before you stress it in different motions that we do day to day. The physical therapists in the care suites will also make sure to show you how to move safely and comfortably while your hip is healing. Most of our patients have minimal outpatient therapy initially following hip replacement. However, some of our surgeons do order that immediately following surgery as well. So you will need to check with your surgeon regarding that. Walking is the best thing that you can do following hip replacement surgery. We encourage short, frequent walks during the day, and our physical therapists provide you with a very robust home program that has a walking program and a phased exercise program, as well as contact information should you have questions or concerns as you're recovering. If the surgeon does order physical therapy a few weeks after your total hip replacement, it usually starts around 6 weeks, and they will usually start with somewhere between 4 to 6 visits, and then you may or may not have more visits depending on medical necessity. Let's talk about the total knee replacement next. So, typically, you're going to go to physical therapy 2 times a week for approximately 30 to 45 minutes. They will initially schedule you for 6 to 8 physical therapy visits, and you will may or may not have more visits depending on how you're doing and based on your medical necessity, discussion with your physical therapist, as well as with the surgeon. Make sure that you have your physical therapy scheduled for after surgery as early as possible, as our physical therapy clinics get booked quite rapidly, and they're usually 3 to 4 weeks out, sometimes more than that. I can't stress enough your outcomes after all joint replacements, but specifically total knee replacement, are highly dependent upon your commitment to your therapy program. So compliance is key. What you do at home, as directed by your physical therapist, is the most important thing. Making sure you have that carryover from visit to visit, and it gets you prepared to continue with your home exercise program after you're discharged from therapy. You're going to hear the terms range of motion, extension, and flexion. Those are the main movements of your knee a lot during your recovery. Frequent motion of your new knee is best. You want to be up taking short walks every hour or two, just during waking hours, and also making sure that you're very gently bending and straightening that knee a few times, up to 10 times every hour. When stretching or bending that knee, it's going to be sore, it's going to be uncomfortable, but that new knee is made to move. Your goal eventually is 0 degrees or a straight knee of extension and approximately 115 to 120 degrees of flexion. Many people do get more motion than that, but it just depends on our body and the state of our knee joint. You may or may not reach 115 to 120 degrees prior to discharge from therapy. As long as you're following the therapy program, you'll continue to see gains up to 12 months after surgery. And sometimes these gains may feel slow. Sometimes they may feel real quick, but make sure that you continue to ask questions, follow your program, and continue to be consistent. It's important that you don't sleep with a pillow or anything soft behind your knee that allows your knee to stay in a flexed or bent position for prolonged periods of time. We highly recommend that you take pillows or something soft that's similar and put those below the knee, or have them situated in a wedge type shape so that your knee is straight when you're resting. The idea is that you keep your knee in a straight extended position while you're resting to help make sure that you have good extension range of motion. While the flexion or bending range of motion is important, that extension or straightening range of motion is very important for walking or ambulation, as well as optimal use and recovery of our quadricep muscle, which works really hard when we're walking and helps straighten out our knee. Therapists will also work with you on strengthening the other muscles that support your knee. And then additional interventions that we also do in outpatient would include manual therapy to help the joint and the kneecap move, as well as modalities such as ice and electrical stimulation to help with pain and muscle activation. Goals for our total knee and total hip patients by 2 weeks after, or excuse me, 2 months after surgery would include doing the stairs normally or step over step, walking community distances without pain and fatigue, being comfortable with your home program, and being sure that you continue with that home program for up to a year following surgery, as well as being able to do the activities that you want, whether that's returning to the golf course, pickleball, going hiking, going back to the gym. You are responsible ultimately for your outcomes. It is so important that you ask questions and are committed to your program. We are here to help and support you. Let's talk a little bit about the total shoulder and physical therapy. So initially following total shoulder surgery, you are in a sling or an immobilizer for approximately 4 to 6 weeks. You can remove that sling for exercises, showering, getting dressed, and eating or tabletop activities. It's important that you don't lift anything that weighs more than 1 to 2 pounds, which is approximately a cup of coffee, for 6 weeks following surgery. This helps promote healing of the muscles or the subscapularis tendon, which is part of our rotator cuff, before you add that more aggressive rehabilitation and therapy exercises in. In the care suites, the therapist will provide you with exercises from your elbow down, so elbow, wrist, and hand exercises, as well as postural education that you will complete at home until you begin formal physical therapy in the clinic. The surgeon directs you on when to start that formal physical therapy, and that depends on the surgeon preference as well as their specific total shoulder replacement protocol. Our ankle replacement patients have precautions for the first 4 to 6 weeks after surgery. Typically, you are either non weight bearing, meaning no weight on that surgical extremity, or partial weight bearing, which means you can put a little bit of weight on that surgical extremity. And the therapists in the care suites will guide you on what that feels like and how to navigate that safely. Post op restrictions are very surgeon specific. So, your surgeon team will also discuss these with you. At 6 weeks post op, you will initiate outpatient physical therapy. In between that time, the physical therapist in the care suites will give you specific exercises to help strengthen not only your upper extremities, but also the other muscles that support that ankle and the other leg. In outpatient physical therapy, they'll focus more on range of motion, swelling and inflammation, weight bearing tolerance, balance, and strength as you learn how to walk normally again as your weight bearing restrictions are lifted.
Okay, so now we're going to talk through billing. So for our Medicare, Humana, and Aetna patients, Excel program is fee for service. So included in the surgery center billing is transportation from the surgery center to the recovery suites, internal medicine visit in the care suites, medication specific to your procedures while in the suites, that piece of durable medical equipment that physical therapy will go over with you and determine which makes the most sense for you to go home with. So the walker, crutches, or cane, on-site nursing services, and then your meals. For our commercial payers, Excel provides one bill called a bundle, and this starts at the time of surgery and goes through 90 days after surgery. So included services would be all physician fees, including surgery, post-op visits, and surgical assistant fees, surgery center facility fee, implant costs, anesthesia fees, transportation from the surgery center to the recovery suites, that internal medicine visit, medication specific to your procedure in the suites, outpatient physical therapy, either at a TCO or Excel contracted location, that piece of durable medical equipment, the walker, crutches, or cane, x-rays at your post-op clinic visits, recovery suite nursing and physical therapy, and then your meals. Excluded services that would be billed to insurance would be a hospital admission, an ER visit, an ambulance transfer, a blood transfusion if needed, ultrasounds, a bladder scan, outpatient prescriptions your surgeon is prescribing, medications unrelated to routine post-op care, interpreter services, 1 year follow-up and x-rays, an additional night in the recovery suites beyond surgeon discharge, and then those icing rentals that I mentioned earlier. We do have our very own billing department. They are experts on all things Excel. If you have any questions about billing, coverage, timelines, anything like that, please give them a call. Their phone number is 952-847-4038. And then there is some paperwork that we need everybody to fill out prior to discharging from the care suites. It's just consenting to the care that you will receive underneath our specific license. We do function under a home care license, and so you might see some of that verbiage in the paperwork, but it's just consenting to that one night of care with us. So there is a link listed here. If you wanted to familiarize yourself with the paperwork, you can click this link and read through some of that documentation. We'll also have all of that here available to you at the care suites, and then you can just sign at some point while you are here staying with us.
We sincerely thank you for choosing our Excel program and for listening to our presentation today. This slide shows all of the nurse coordinators. If you need to refresh your memory on their email and their phone number, if you would like to reach out to them. We do also like to say that we recognize that there are multiple choices for orthopedic care available to you, and we sincerely thank you for trusting us and choosing us for your care. We love our program, and we hope that you have a wonderful experience.